Hi, my name is Hazza June. I'm a student at FCJ Term 2, and today I'm going to demonstrate how to administer IV medication through piggyback. First, I'm going to do the standard protocols. I'm going to check for the physician's orders for the dose, route medication, and frequency of the medication that I'm going to administer, as well as the lab values of my patient, as well as their allergies and their history of allergies. Today I'm going to administer Flagyl, which is a bactericidal. It disrupts protein synthesis. My patient has pneumonia, so it's going to help with their respiratory tract infection. Safe dose is 7.5 milligrams per kilograms, which is already previously done, or 500 milligrams every 6 to 8 hours. Side effects include seizures, Stevens-Johnson syndrome, phlebitis to the IV site. Interventions include frequent mouth rinses, reporting dark urine, superinfection, and avoid alcohol. And it's to infuse over 30 to 60 minutes. My dosage calculation. I'm supposed to administer 500 milligrams every 6 to 8 hours to infuse over 60 minutes. 500 milligrams is equal to 0.5 grams. 0.5 grams is equal to 2.5 milliliters. 2.5 milliliters plus 50 milliliter normal saline is equal to 52.5 milliliters, which I will administer over 60 minutes. Okay, so I'm going to grab my Flagyl and my syringe. I'm going to clean off the port. And pull up 2.5 milliliters of air. So after I cleaned it off, get the air in, and bring up 2.5 milliliters of liquid or medication. Make sure there's no air bubbles. Okay. And close it off. Now I'm going to grab my normal saline bag, and in a normal hospital setting I would use a needleless cannula to put the medication in here, but because my needleless cannula does not stick through the little port, I'm going to have to use my needle. So I got my normal saline bag. I'm going to clean off the port with the new alcohol wipe and administer my medication. And then this, of course, goes into the Sharps container. I'm going to mix my medication. Okay, and then I'm going to label my normal saline bag with the medication, Flagyl, the dose, the time I put it in there, my client's name, as well as my initials. So I'm going to grab my tubing, my piggyback tubing. Okay. Make sure my clamp is closed. And I'm going to grab my medication and clean off the port with a new alcohol wipe.
Oh, you don't know which one you just want to do.
I'm going to spike my chamber. Okay. And then I'm going to unclamp it and prime my tubing. Make sure there's no air. Alright. And then we're ready to go see the client. Okay. So I would wash my hands and put on my clean gloves, and then I'll check my client's armband for their name and birthday, as well as ask them for any allergies that we may have missed. Check the primary IV line to see if there's any phlebitis, so usually if it's red or if it's warm, or infiltration, which is cool and leaking. And we're going to assume my patient's IV line is patent. Okay. So first, I'm going to grab my primary medication and hang it below where I'm going to put my piggyback medication. Grab my piggyback. Okay. And as well, I'm going to put a label on my tubing as well.
Is it the 3 P's now?
with the date, time, initials. Okay. And then I'm gonna use a new alcohol wipe and clean off the port. Clean out the other port. I cleaned it off. And then I'm gonna stick the thing in here, but my tubing was broken, so it's not gonna really stick in there. So, but I stuck it in there. And then I'm going to unclamp my, clamp my primary tubing, and then unclamp my piggyback. I'm going to establish the flow rate, make sure it's going. Okay, and then that's how you administer the piggyback. And then I'm going to come back periodically. I'm going to remove my gloves, wash my hands, and then I'm going to come back periodically, check on the IV side, see if there's any allergic reactions, and make sure it's okay. And then after it's done infusing, I would clamp this off, clamp off my piggyback, and then bring this back up, unclamp it, and establish my flow rate again as well. Make sure everything's going the right rate. And then now I'm going to document on my MARS how the IV site was, the medication, the dose frequency of the medication, as well as the intake and output, and the time I put the piggyback. And that's how you administer IV medication through a piggyback.